Officer, who's here with us today, and Kathy McNeil, who's the President and CEO of Island Health. And also a shout out to the other Island Health staff that we have here today and people who are working in our health system. Thank you so much for the work you do. I come out of a nonprofit sector where I've worked on with people who have struggled with addictions and issues with substance use, and know how important today's announcements are. I'm so happy we're here in a healthcare setting to do this. I welcome to the podium Josie Osborne to talk about what we're doing today.
Great, thank you. Thanks so much, Diana. It's a real privilege to be here in the Royal Jubilee Hospital, and I want to acknowledge, of course, the privilege it is to be on the territories of the Lekwungen-speaking peoples, the Esquimalt and Songhees nations. I'm Josie Osborne. I'm BC's Minister of Health, and I am grateful to be able to share these words with you today. The toxic drug crisis continues to have an absolutely devastating impact on communities and families across the province. And I certainly have heard heartbreaking stories from family members and friends of people that we have lost to poison drugs, and from first responders and care providers who've tried everything that they can do to save a life. This crisis takes a devastating toll. And because it is such a complex public health emergency, we need to consider every option and tool available to save lives and to help people who are struggling with addiction. In 2023, we launched a pilot program to decriminalize people who use drugs. Our intention was clear: to make it easier for people who are struggling with addiction to come forward and seek help. From the beginning, this pilot was designed as a time-limited trial with ongoing monitoring built in so we could understand what was working, what wasn't, and where changes were needed. However, the pilot hasn't delivered the results that we hoped for. And after very careful consideration, we are not asking the federal government to renew the exemption. I want to take a moment to acknowledge all the tremendous work, the commitment, the expertise that went into this pilot over the last 3 years. Advocates, health authorities, and people who are working on the front lines helped implement the pilot on the ground and contributed significantly to what we've learned. And I also want to sincerely thank the police, who provided essential operational input during the development of the pilot and whose ongoing contributions helped address emerging needs and evolving public safety concerns. Our government remains absolutely committed to exploring every option, to using evidence-informed tools that can save lives and help connect people to care. Our priority has always been, and it continues to be, making it easier for people who are struggling with addiction to get the help they need where and when they need it, because we believe strongly that addiction is a health issue, not a criminal justice issue. That brings us to why we're here today. Today marks another important step in making care easier to reach and easier to navigate. In 2023, the Road to Recovery program was launched at St. Paul's Hospital to support people facing addiction and substance use withdrawal in the Greater Vancouver region. It's an innovative model that's designed to provide a full continuum of care in one coordinated system. It offers assessment, stabilization, treatment, and ongoing supports so people are not left on their own to navigate the system, a complex system. And a key part of the Road to Recovery program is Access Central. It's a phone line that helps adults connect to withdrawal management or detox supports quickly and easily through a single point of access. And today, I am very proud to share that Access Central has expanded, and it's now available throughout Island Health, Fraser Health, and Interior Health, with Northern Health coming online later this year. When someone is ready to seek support, they can call Access Central and receive an assessment by phone within 24 hours or be referred to a clinic for an in-person assessment. And from there, Access Central helps connect people to a range of services, and that includes inpatient detox beds, medical withdrawal management and stabilization, and opioid agonist therapy where it's appropriate. We know that this model is making a difference. Access Central Vancouver has received more than 34,000 calls between October 2023 and December 2025. And during that same period, more than 3,500 people were connected to withdrawal management beds. And beyond the initial connection, Access Central stays involved, providing guidance throughout a person's withdrawal and recovery journey, and that ongoing connection is critical. It helps people keep moving forward on their road to recovery, healing, and working through their substance use challenges. And I really want to thank our health authority partners for the incredible work that they do every single day, helping people in their communities access the care and the support that they need when and where they need it most. Access Central is just one part of our government's broader work to build a strong and comprehensive system of mental health and addictions care here in British Columbia. And since 2017, we've invested over $2 billion in mental health and addiction services, and we're seeing meaningful results. Since 2017, we've opened more than 760 new beds that support people with addictions. We're opening involuntary care beds across the province, including at the Surrey Pretrial Services Centre, Alouette Homes, and more spaces opening in Surrey and Prince George. We've reduced wait times for withdrawal management from 26 days down to about 8 days. And we launched the Opioid Treatment Access Line, which connects people with same-day medication and care for opioid use disorder. From October 2024 to September 2025, the line received more than 2,500 calls and provided close to 650 prescriptions to people across BC. Now, at the same time, we know just how important wellness promotion, prevention, and early intervention are at stopping small problems from becoming bigger ones down the road. And that's why we've opened Foundry Centres across the province, providing mental health, substance use, and primary care services to youth. There are 19 Foundry Centres operating today with 16 more on the way. And we're expanding integrated child and youth teams to ensure that children and families can access the mental health services that they need closer to home. We can never forget that people who are struggling with addictions are our family members, they're our friends, they're our neighbors. And as the toxic drug crisis continues to evolve, our response must evolve with it. We will keep adapting and learning and taking bold steps to help turn the tide of this crisis while doing everything that we can to help people get the care that they need without fear, stigma, or judgment. To anybody who is listening here today who wants to make that step to help, please reach out. Please visit www.helpstartshere.gov.bc.ca. Just that one click, that one call to Access Central could make all the difference. Thank you so much.
Thank you, Minister Osborne. It is life-changing for somebody who needs care to be able to get timely, compassionate, and effective support to help them on their path to recovery. I'm so proud of the record that Minister Osborne shared with you of what we've been doing to make it easier to access the care, for it to be better coordinated and more responsive to people's needs. Strengthening services across British Columbia, helping to build out that full continuum of care is helping people to get the support, and so critically, it's for when they need it. Recovery is possible with compassionate care and strong community support. People can be rebuilding their lives and looking forward with hope. So thank you so much, Minister Osborne, for sharing the initiatives we've had and the work that we're continuing to do to ensure that those supports are there. And now I welcome to the podium, Leah.
Thank you very much. Thank you all for being here with us today. I'll start by acknowledging with respect the traditional and unceded territory of the Lekwungen-speaking peoples, now known as the Songhees and Esquimalt nations, on whose land we gather today. In making this acknowledgement, I commit to walk softly on this land and work to uphold Indigenous self-determination. I also acknowledge the Métis, Inuit, and other First Nations people who live in this region. There is a moment many people in recovery describe, a private, deeply personal turning point when they realize something in their life needs to change. Sometimes that moment comes when they hear someone else's recovery story and think, maybe that could be me. Sometimes it's a parent or caregiver longing for more time, better time with their children. And sometimes it's simply reaching a crossroads, a moment of honesty, vulnerability, and courage when someone decides to reach out for help. We need to be there for them in that moment. When a person takes that step, they shouldn't have to navigate a maze of services or wait days for support. They deserve a system with their bravery and compassion and meets their urgent needs with timely care. Because when someone makes the brave and vulnerable decision to seek help for substance use, they need access to compassionate treatment and care quickly. This is exactly what the new Virtual Access Central service offers. Access Central is more than a phone line, it's a lifeline. It ensures when someone reaches out for help, our care team is ready to provide the support they need and deserve with dignity and respect. By calling one number, people will connect to a dedicated virtual substance use team, including nurses, a counselor, and an addiction medicine physician. People will receive personalized substance use care planning, including same or next day virtual clinical screening, assessment and triage, as well as withdrawal management services. This new service is part of Phase 1 for Road to Recovery at Island Health, marking an important step toward improving substance use care across our region. Together, we have the opportunity to make a real difference, to ensure that when someone reaches out for help, they find hope, compassion, and timely care. Thank you for standing with us on this journey. Your presence today reflects a shared commitment to building a system that truly meets people where they are with dignity and respect.
Thank you so much, Leah. And now I'd like to invite Kim Keats up to the podium, who's going to speak from a frontline worker perspective about the Health Access Central and how it's working to support people seeking support.
Thank you. I am so excited. I am just so excited to be a part of our new virtual substance use team and Access Central. I'm a frontline nurse, and I meet people at their most vulnerable point, most vulnerable moment in their lives. And the hardest part, it's not the assessment, and it's not the treatment, it's the moment before that. By the time people reach out and connect with us, many have tried to navigate a system that is just, it's complex, and they're all alone often. They have waited, they've been referred or re-referred. They have told their stories so many times. And sometimes they're exhausted before care even starts. I work with people taking that very first step. And I also work with others who have been surviving substance use for many years. What they have in common is this: they reach out. They reach out because it's important to them. And what they have in common when they reach out is that the timing matters, and the clarity matters, and how they are met matters. For people living in rural and remote communities, those moments are often harder. Their distance is a factor, limited social services and limited local services, long waits, and missed windows of care. They can turn their motivation into discouragement, and that can happen so quickly. I've seen how people can fall through the cracks when access is complicated. Access Central was built to meet those realities. From the front line, what changes really, it's simple, but significant. People are not left trying to figure out where to go next. They're not bounced between services. They're connected quickly to someone who can assess, someone who can guide, and someone who can support them right in that moment. It shifts the experience from the challenge of looking for help to being met with it. And that shift is what is so important. Because when someone finds that courage to reach out, they deserve a system that is ready for them. They deserve a system that responds with respect, reduces barriers, and helps them stay connected during their substance use journey. From where I stand, really, Access Central is the right answer for that. Thank you.
Thank you, Kim, and it's so great to hear that firsthand perspective on the work and the impact that this is having for people. As has been mentioned by a number of the speakers, timeliness for compassionate care and access are so critical, and that's the real difference. I know from stories I've heard already on the South Island here about the impact these programs and our government's investments in the continuum of care are having for people in our community, and I'm really excited to see this program unfold. I'll conclude that concludes this part of the press conference, and now we'll move to questions.
Thank you very much. Reminder to media on the line, if you're there, please press *1 to enter the queue. You'll be limited to a question and a follow-up. We'll start here in the room with Katie DeRosa from the CBC.
Minister, what does the changes mean in practical sense? Will police officers start arresting people again? We know that some police departments, Vancouver Police, already were kind of practicing not charging people for decrim. It was sort of a hodgepodge depending on which department. So will police be directed to charge people, and do you expect Crown to be approving charges for simple possession?
Thanks, Katie. So first of all, the police have been really important partners in this endeavor, and the province does not direct police what to do. However, that relationship has been a really important part of establishing the pilot, of having a relationship throughout the pilot and receiving their ongoing advice and feedback and making the changes that we have. What people can expect to see once the decriminalization pilot ends is they can expect to see the police continue to do the job that they do. And they have, together with the province, I think we are all on the same page when it comes to asserting that we are taking a health-first approach. And that means the police will continue to use the expertise, the judgment, the discretion that they have in dealing with individuals, in making a decision to help them move along, for example, to an overdose prevention site, a place where they are much more likely to be connected to the care that they need and may be actively seeking. Police will continue to work with us, and as we go through this transition, of course, our intention here, and always the intention of the decriminalization pilot, was to shift people out of a criminal justice system, one that can have incredible effects on a person's own sense of dignity, on their employment, on their housing, on their relationships, and be able to connect them with the care in a healthcare system, taking a health-first approach. And that's what we'll continue doing together with the police, supporting each other as we can.
So since BC was a test case for the rest of the country, do you regret going down this path? Like, did decriminalization fail, essentially?
I think it's important, first of all, to acknowledge just how complex this public health emergency is. And second, that the conditions around us are changing all the time. And we have seen, for example, the toxic drug supply itself change with fentanyl coming in, and then carfentanil and veterinary additives and things that are making people sicker and are contributing to deaths. That's why it's so important that we consider and take every chance we can to try something new, using evidence, using data, and again, working together with police, stakeholders, health partners in designing the decriminalization pilot in the first place. This was always a time-limited trial, and we were always clear that we would monitor and evaluate the trial as it went on. And as I said before, not providing the results that we wanted to see. We've made the decision to end the decriminalization pilot, but that in no way changes the work that we're going to continue to do to build out that very strong, that comprehensive, seamless system of care for people. And that's exactly why we're here today. And just hearing directly from Kim to speak to a single point of access for somebody to remove the gaps and barriers and having to manage different wait lists or call different numbers or see different people, but to have that single point of entry, that is truly transformative in a substance use care system. We've seen it and the impact it's making in Vancouver. And that's why I'm just so proud to see that we're expanding that across into different areas of the province.
Thank you very much. Thanks as well to folks on the line who have rejoined. We had a quick drop there. Please do press *1 to enter the queue. You'll be limited to a question and a follow-up. Next question comes from Mary Griffin, Check News.
Minister, just wondering, just to be clear, is it now illegal again to possess cocaine, fentanyl, heroin, meth in any amount?
Yeah, without the exemption in place, previously decriminalizing people who possess small amounts of those substances, 2.5 grams or less. Now we return to the original wording of the CDSA, the federal act. And again, this is only for the exemption that the province was granted by the federal government. It doesn't impact the exemption that is already in place for drug checking sites and for supervised consumption sites. Those are under a separate exemption.
And just to follow up, sorry, just going to my question here. How many people were actually directed into drug treatment and recovery as a result of decrim? And did you measure or track this? And if so, how?
Well, it's a great question, and it's a very challenging one to answer because there are many different programs available for people. There are many different policies and tools that are being used. And one of the challenges is to isolate the impact of any outcome that we're seeing and narrow it to a causal relationship that is attributable to just one thing like decriminalization. We certainly saw that in the initial months of the decriminalization pilot that possession offenses and seizures came down. We see that more people have accessed overdose prevention sites, but it's a challenging system right now to be able to measure direct self-referral or referral into treatment and recovery programs. But again, I just want to come back to the intent here. The intent is to shift people away from a criminal justice system, use a health-first approach, and to help reduce the fear, the judgment, the self-stigma that people have in reaching out for help. And I want people to imagine, somebody who is facing challenges with substance use, who perhaps is living at home with their family and not even their family knows what they're going through. The fear of what can happen in reaching out for help is serious, and it can stop people. Decriminalization, decriminalizing the people who use drugs, always the intent to help make it easier to access supports. And that's why we will stay focused on all of the other work that we are doing to increase people's access to services, to, again, coming back to Access Central and virtual supports, making it easier for people who live in remote communities, for example, so that they can talk to somebody and get on a pathway to recovery that they are looking for.
Next question comes from Jonathan Bartlett, Global News.
Thanks, Minister. This question is from Aaron MacArthur. Healthcare measures for recovery and care is one thing, but how does recriminalizing people with small amounts of illicit drugs help? People are not likely to seek help while they're dealing with the criminal justice system. Shouldn't you be doing both those things at the same time?
Well, again, I think the opportunity to take to use every tool that we can to try all different approaches in reducing the fear and stigma that prevent people from reaching out for help, conversations that people are having, public awareness campaigns, helping people access help through overdose prevention sites and other harm reduction measures. All of that taken together is a very important part of helping to increase the likelihood of somebody reaching out for help. And I think we all have a role to play in this. I encourage anybody who is watching and listening to visit helpstartshere.gov.bc.ca to see for themselves videos, firsthand expressions of what people have gone through to help better understand and know how we can support people who are seeking help at a time that is incredibly challenging, as Kim spoke to. We are going to continue not focused on any single solution, knowing that there's no magic bullet for this, but understanding that our focus on saving lives, on strengthening pathways to care, making it easier for people to access that care, using and implementing solutions that we are seeing are most effective. We will continue to do that work so that we can try to turn the tide on this incredibly devastating crisis.
One more question in the room before we go to the phones. Emily Javeski, Vista Radio, go ahead.
Hi, Minister. Thanks for taking my question. You mentioned earlier, I think, that the pilot program didn't quite reach the threshold for what you wanted to see out of this pilot. So can you talk a little bit more about that and what exactly weren't you seeing? And I guess also, what were some of the lessons learned here?
Yeah, thank you. I mean, the ability to test and to learn and to adjust was a core part of the pilot program. And we certainly did see some progress, again, shifting people away from the criminal justice system. We saw that the rate of possession offenses, the seizures of drugs did go down, especially in that initial first part of the decriminalization pilot. And it's really important to acknowledge, too, that we funded outreach positions in every single health authority, including the First Nations Health Authority, people who are working to support law enforcement and healthcare providers in their communities to help improve service navigation. We've seen the addition of new pathways to care and expanding the services that we have. Those are all an important part of it. And yet, decriminalization, again, it's at the end of the 3-year pilot, it is difficult, if not even possible, to attribute certain changes or increases directly to decriminalization. We want the focus to remain on people who are struggling with addictions. And that's why it's important to continue to expand the system of care and to support public awareness and in doing that and in a way that continues to help reduce stigma and help people access care.
And just to follow up, what were some of the conversations you were having with officials in Ottawa around this decision not to continue with the pilot?
Yeah, our partnership with the federal government is obviously a really important one, and we have been having conversations with them over not just the past month as we, or month or weeks previously as we approached the January 31st end of the decriminalization pilot, but in previous months and years too, as we were working to amend and change. And I know that people have seen, we've undertaken a few course corrections and changed things as feedback from the public came forward, our conversations with police and enforcement, understanding what was happening out on the streets and what was happening in people's homes and how we could adjust in a way that helps us remain focused on that health first approach, but also take into account really important public considerations around public safety and perceptions of public safety and wanting to help people in any way that we can, but understanding people need to be comfortable and when they're out in their communities. And those are all part of the conversations that we've had with the federal government.
Next, we go to the phones. We hear from Penny Dufflos, CTV. Go ahead, Penny.
Is that the pilot didn't deliver the results that you'd hoped for, and you just mentioned a few of the things that you'd achieved, but what would it have taken to continue with this pilot project and to continue with the exemption? Like what was your kind of ideal scenario to keep this thing moving forward? I'm still kind of unclear on that.
Yeah, thank you. Again, the pilot was designed as a 3-year trial. And a number of different indicators that have been measured over the past 3 years. We do submit quarterly reports to Health Canada as required by them and are publicly available. And we've continued to work with the BC Centre for Disease Control, for example, and some of the monitoring and evaluation directly involving people who use drugs. And I think, ultimately we were not seeing results in the way of a huge increase in self-referrals to care, an increase in the use of certain kinds of services, and the public awareness and understanding that's necessary, creating all the conditions for success. But again, I think it's important to acknowledge when this decriminalization pilot started, it was at a time, deaths were at an all-time high. We know the devastating impact that is having on people, and it's a responsibility and an obligation for us to work together with partners to consider all of the different approaches and ways that we can undertake to help people who are struggling with addictions and the outcome that has on their lives, on their families' lives, on their communities, on their neighborhoods. So the decriminalization pilot may have ended, but again, coming back to today's announcement around the standing up of Access Central, the work that we are doing to coordinate and provide faster, easier access for care, and continuing other services, other harm reduction services, continuing to expand the treatment and recovery system, adding more beds, standing up the opioid treatment access line. All of this work is part of strengthening and building out a complete system of substance use care and recovery.
Follow-up, Penny?
How much did public sentiment and concerns about public safety factor into this decision?
Public safety is obviously, it's a very important factor in so many different aspects of the toxic drug crisis and what we are seeing and witnessing and how people are feeling. It is very difficult to measure social disorder, for example, and a sense of public safety, but it's important to put it in context. We knew, and the Premier's been very clear, we were never going to return to the decriminalization pilot as it currently was when it first began, and we saw over time that course correction, that adjustment, those changes to limit or narrow the places where decriminalization of the possession of small amounts of illicit substances was going to be exempted from federal law. That's, again, knowing that the decriminalization pilot has ended, it's important, and we will continue to work with police, because taking that health-first approach, knowing that police themselves are first responders, they often encounter a person for the first time in dealing with public drug use, for example, something that makes almost all of us feel uncomfortable and contributes to concerns that are very understandable and are very valid. Taken in context, moving forward to help the police with tools and other first responders with the tools and supports that they need to help move people on where there's no criminal intent, and police are using their judgment and their expertise, their discretion in those interactions with people. We'll continue to do that work with police while they obviously continue to retain the authorities that they have and their mission to uphold the laws and to protect the public.
Next question comes from Mark Page, Black Press. Mark, please go ahead.
Hi, Minister. Thanks for taking my question. Now, do you believe, is it your opinion, I want your opinion here, that people who are found with small amounts of illicit drugs should end up with a criminal record?
It's my belief that we need to take a health-first approach. Nobody wakes up in the morning and says, I want to get addicted to drugs. I want to use drugs today. I want this to become a lifelong problem, one that impairs my relationships, my employment, my housing, my ability to thrive and succeed like my neighbors and my friends and my colleagues. Nobody asks for that. That's why it's so important that we take a health-first approach and treat this as the public health emergency that it is. And at the same time, that we work together with the police on social disorder, on public drug use, and on other factors that are an important part of the way we live together in society here. I am encouraged by the work that we have done with the police, by the partnership that we have with them as enforcement agents, and being able to to shift away where it's appropriate from the criminal justice system to give people the chance to get connected to the supports they need, to get them on the road to recovery, and to help them return to a life that they may previously have had, and to live the life that they want to lead.
Follow-up, Mark?
Right, but if somebody ends up with a criminal record for possessing, crack cocaine or methamphetamine or something like that, does that not make it more difficult for them to return to their previous life and become a productive member of society?
Well, I think we can all try to imagine what it would be like to be in somebody's shoes who is facing that, and knowing that a criminal record can affect your ability to travel, can affect your employment, can affect how the people around you feel about you. These are all serious things that people face, and for reasons, again, that nobody asked for in the first place, to struggle with addiction. Thinking of people who come into addiction by a pathway of pain medication or injuries on the job, thinking of people who are struggling with mental health issues in life and needing supports. That's why it's so important that we invest in every aspect of this continuum of care, right from the very beginning, in our schools, in our families, in our homes, adding supports and intervention and prevention for children, for youth, for families, right through to the ability for somebody to call a single line, an access central line, and be able to talk to somebody to get the help they need and get connected to the care that they need, adding beds, adding recovery services, helping people through what can, for some, is a lifelong journey in struggling with addiction, and being there to support them, and again, just treating this as the health-focused issue that it is.
Our next question comes from Andrea Wu, Globe and Mail. Go ahead, Andrea.
Andrea? Oh, hi. I wanted to follow up on a question that's been asked a couple of times already. I just want to make sure I understand. It's regarding the pilot not having delivered the results that we hope for. You mentioned that we're not seeing results in terms of self-referrals to care. So does that mean that the province is viewing decriminalization as a failure because there was no increase in people seeking out substance use supports? And if so, are there other metrics that we're looking at?
Again, it is a challenging it's a challenging place to measure when we have a very complex public health emergency. I'm just going to pause for a moment for the hospital. Thank you. Again, a very complex public health emergency with different approaches, policies, tools that are being used, and it is challenging to attribute changes that we're seeing to any one policy. But we know while decriminalization has had an impact, as I've already spoken on certain things, that by not achieving the outcome that we hoped within the 3-year pilot of seeing that a measurable decrease in stigma and fear and addiction that prevent people from accessing services, and public conversation around decriminalization that has become very challenging. And knowing that we want to take a health-first approach, we want to center and focus our work on the people who are facing substance use challenges, and to do that in a way that is supportive through interactions with the police, by increasing the number of supports and the availability for people, by building out a system of care and filling in those gaps as we've been discussing today. We want to pursue the approaches that show the greatest potential at being effective, and we won't stop doing that with a focus on saving lives and strengthening pathways to care.
Follow up. Sorry, Andrea, do you have a follow-up question?
I do. There are some who say that decriminalization was oversold, that it's an important tool in reducing the harms associated with criminalization for people who use drugs. And there is data showing that it led to a significant reduction in criminal justice encounters for possession. But it is a very limited intervention that was never going to address these bigger issues of addiction, of getting people into treatment, of the toxicity of the drug supply. And so in that sense, it was sort of set up to fail. And I'm hoping you can speak to some of the early promises, the early language around decriminalization, and whether you feel that messaging may have been a bit off.
Returning to the original intent of the decriminalization pilot, to reduce the fear, the judgment, the shame, the stigma that people have in reaching out for help. It is an obstacle, and that's well known and it's well documented in the literature and in other jurisdictions. By undertaking a decriminalization pilot, one that was designed with the input of police, with the input of stakeholders and care providers, that was thoughtful in its approach, and then implemented. And I would say there there's probably never a perfect time or a perfect set of conditions to undertake a pilot like this, but I'm proud of the fact that we did try. And I think it's important, again, to acknowledge the seriousness of this public health emergency and knowing that carefully designed pilot, and one where we are monitoring and evaluating. You've seen the course corrections that we've made along the way. It was a very well-intentioned attempt to add one more tool to help increase access to care, to help people seek the help that they need at a time when they need it most. With the decriminalization pilot ending, though, we continue our work. We continue this work of adding treatment and recovery beds, continuing to expand the intervention and supports, continuing to expand harm reduction services, and undertaking everything that we can to save lives, to help to build up and increase access on those pathways to care, acknowledging that each person's journey is different. It will look different for people, and we want to be there when they need the help at the time that they ask for it, which is what Access Central is all about.
Next question comes from Ashley Joanno, Canadian Press. Go ahead, Ashley.
Hi, good afternoon. I'm just wondering to what extent you think the decriminalization was to blame for the record drug deaths that BC saw in 2023 after the program had started.
I'm sorry, could you just repeat the question? I just missed the middle part there.
Yeah, I'm just wondering to what extent you think decriminalization was to blame for the record drug deaths that BC had in 2023.
Well, again, it's very difficult to attribute the overdose death numbers to any single factor. But we have seen in 2023 and in 2024, and we expect to see in 2025, again, a decrease in overdose deaths. And that's encouraging, but it's not enough. We want to continue, of course, to drive down those numbers, and that's why we'll continue with the work that we are doing in expanding the full continuum of care, filling in the gaps, making it easier for people to access the help that they need.
Follow up, Ashley?
So if I understand things correctly, the program will officially come to an end on the 31st because that is when the current agreement with Health Canada ends. What are you doing to actually inform user groups or the community more broadly about what's coming?
Yeah, thanks for the question. So we have just over 2 weeks before the decriminalization pilot officially will end. That's why it's important for me to be standing here and talking to the public about that upcoming change. And I am working closely, of course, with the Minister of Public Safety and Solicitor General, with their ministry, and together reaching out to the police, working with them as obvious partners, but also speaking with stakeholders, with health authorities in the upcoming transition. It is important to take that time for people to prepare for changes that will be coming, and for us to continue listening and hearing about any challenges that are being faced so that we can make the appropriate changes and set things in motion for the smoothest transition possible.
Next question, Fran Yainer, Northern Beat.
Well, thanks for taking my question. Hi, Minister. I'm just wondering, addictions experts, even Bonnie Henry in her 2019 PHO report recommended decrim be part of like a multi-pillar drug strategy, education, prevention, treatment, and in the case of Portugal, which even Henry referenced, reintegration into society. I'm just wondering, do you think that decrim failed because those pillars were not in place to support it?
The situation in Portugal is a bit different than British Columbia, and again, there are comparisons we can draw from how things have been undertaken in Portugal, but it's really important that we made and designed our decriminalization pilot here in British Columbia, taking into account the context here, taking into account factors like a rapidly changing toxic drug supply, for example. I value Dr. Henry's advice, and that's an important part of the design of the decriminalization pilot, and being able to make the adjustments that we've made. We don't make public policy in a vacuum, of course, and we want to make the best, most informed, evidence-driven decisions, and we make that in context of public awareness and the perspectives that we have heard loudly and clearly from communities why we made some of the changes that we did in 2024, for example. Now with the decriminalization pilot coming to an end, it's important for all of stakeholder groups to understand, how we feel about what worked and what didn't work. Our reporting to the federal government will also come to an end as the decriminalization pilot ends, and we will be able to produce a final report that, of course, will be publicly available. And I am certain that there are, a number of different academic groups and people who have been involved in decriminalization, not just in British Columbia, but in other jurisdictions, who will have much to say. We're going to learn from this. We've adapted along the way. We're going to continue to use those learnings as we move forward.
Follow-up, Fran?
Yeah, thanks. Even in BC's application or the criteria that it had to meet with Health Canada, treatment was supposed to be in place to support decrim, which obviously isn't the case even now. So if the point was to move people from the criminal system into treatment, and this is an experimental program because it's being implemented unlike anywhere else without all these other supports. I guess I'm following up on Mary and Andrea. It's like, what data did your ministry collect to measure whether this experimental program and how it was being implemented was achieving the public policy goals? Like you reference, we talked about the arrests going down, which is obvious if it's not being criminalized anymore. Self-referrals, can you give us what data was actually being collected and how did that, it seems a little facile to say it was complex and so we don't have any data, and what do the data reveal?
Yeah, thank you for the question. So you can see firsthand in the reports that we have submitted to Health Canada, the different indicators that have been used, the data that's been collected and submitted all along the way, some of which I have spoken about and is all there. And again, as the decriminalization pilot comes to an end with the final report coming out, there'll be that synthesis and analysis of those data. And that's been an important factor, an important consideration in this work. And I'm happy to follow up with you, Fran, with more background information about that.
We have time for one more question today. To anybody still on the line hoping for a question, we will be getting in touch to make sure that you have the information you need. Our last question today goes to Amelia Macauer, Radio Canada. Amelia, please go ahead.
Hi, Minister. Thank you for taking my question. I was wondering, Minister, there was a pilot that was similar in Oregon, and they also did the same thing you did today, just walking back on decrim. And a lot of experts were saying that one of the things that didn't work out was the fact that we didn't have enough treatment beds and services and not enough, I guess, good ways to redirect people that need a treatment. All of these going at the same time as decrim. So do you feel like we were in the same kind of pickle?
There are a few important differences between what happened in Oregon and how we undertook it in BC. In Oregon, it was a legislative decision. Ours was always designed as a time-limited trial, as a pilot that had evaluation and monitoring built into it so that we could learn and adapt as we went along. We know that having support present for people, treatment and recovery options, the ability to access, like Access Central that we're talking about today, is a really important part of connecting people to care. As I am often reminded by people in recovery, the opposite of addiction is connection. And being able to connect people in every way possible through harm prevention services, through awareness campaigns, through conversations with family, friends, coworkers, by making it easier for people to access help is absolutely essential. That's why we've continued that work. That's why we've built 760 treatment and substance use beds over the past several years. It's why we've introduced the opioid treatment access line. It's why we're building out Road to Recovery across the province. It's why we're building foundry centers, using integrated child and youth care teams, and all of these different approaches to help intervene, to help prevent, to help connect people to when they need it and are ready for it, detox services, withdrawal management, treatment, and all of the recovery and aftercare. Our commitment to building out that system has not changed with the end of this pilot, and we will continue to focus on the people who are struggling with addiction and taking a health-first approach to this public health emergency.
Follow-up, Amelia?
Yes, please. Minister, you're saying that it's a health-first approach. If we look at data, by October 2025, we had the lowest rate of a death from illicit drugs in 2019. So I'm just wondering if you could explain why walking back on decriminalization when we see the lowest rate in death from illicit drugs. Is it because of public discourse that's winning over people actually dying less from drugs? Like I just need to trying to understand the decision today.
Yeah, again, it is an obligation, I feel, of government to undertake and consider any tool that we can, any option that we have to help separate people from the illicit drug supply, help make it easier for people to access the care and the support that they need. And decriminalization was a time-limited trial. It was a pilot designed to test some of that, to add to the suite of policies and tools that are out there. As we've talked about at length today, we don't feel that it met the results or the outcomes that we had hoped to see. And rather than continue, in some places, really difficult conversations, it is, in my mind, much better to keep that focus on people and on the policies, the tools that we have, that we know are effective, that we know are working, and that enable us to continue to put a person at the center of all of this, to continue to focus on an individual who is struggling with addiction so that they know it's okay to reach out for help, and that when they do, help is here. Everybody's recovery journey looks different. There is no one set of tools or one single pathway that will work for people. And that's why we will continue to implement and consider and implement anything that we know. And we know that there are many strategies that we're using now that are effective. We're going to continue that. I'm very grateful again to all the partners that we have had throughout the decriminalization experiment and this pilot, where we know that without that support and help in designing a decriminalization pilot and being able to evaluate it and being able to implement it, we wouldn't be where we are today, having learned what we have and moving forward, continuing to build out and strengthen that system of care that people are depending on every single day.
Thank you very much. That concludes today's event.
You have been listening to BC's Health Minister Josie Osborne issuing an update on the province's decriminalization pilot. As you heard, the province will end the pilot and will not seek to extend it after January 31st, when it is set to end. The province says that it did not provide the results that they were looking for. They're asking people who are dealing with addictions to seek support through Access Central. Much more coverage of this today on CBC. You can always go to our website anytime as well, cbc.ca/BC. I'm Michelle Elliott. Thank you for watching. Have a good afternoon.